Dogs make the best companions for humans. This podcast aims to help make humans better companions for their dogs. Welcome to the Baru Podcast, a modern lifestyle podcast for dogs and their people. I'm your host, Charlotte Bain. I've been caring for other people's dogs for more than 15 years. And while I've learned a lot in my career, I definitely don't know it all. So I've collected an ever-evolving roster of amazing dog people. And I learn new things from them all the time. Hi, you guys. Thank you so much for joining me for this episode of the Baru Podcast. This is the first episode of 2023. I'm kind of jumping into this new season with probably the hardest topic when it comes to pet guardianship, and that is end-of-life care. I have yet to have to experience end-of-life care with my own pup, but as he ages, he's going to be 15 soon, and he's doing really, really well. I'm just going to put that out there, but I thought it would be helpful for me to learn more about the process of hospice care and more about euthanasia. I'm not certain anything can really fully prepare me for the emotional side of losing him, but I think understanding the practical side of end of life and the technical side can hopefully help make it just a little less scary. So in this episode today, I chat with Dr. Nick Labriola of Lap of Love Veterinary Hospice. Dr. Nick specializes in end-of-life care, and we chat about what to expect from hospice care, what to expect from euthanasia, and what to look for in our pups, and how to know when it's time to make some of those really difficult decisions. So, a warning that the subject matter is a heavy one, but Dr. Nick is fabulous, and he answers my questions while keeping the tone light. So, let's just jump into the chat. What kind of a puppy is he?
He's a Chihuahua.
He's a Chihuahua. Is he a puppy?
No, he's like 7.
How'd you come about him? You said he was.
Yeah. So he was one of the surgery dogs in vet school. One of the local rescues, like they brought a lot of dogs over every week for us to like spay and neuter. And of course, like with board certified surgeons, like watching us, making sure we were doing it right and everything. And yeah, he was one of them. And I was like, what? This is a good Chihuahua. I was like, this is like one of those rare, perfect Chihuahuas. Like, I have to take this Chihuahua.
He lucked out.
And it was kind of a joke at first. I was like, guys, I'm going to take that Chihuahua. And everyone was like, yeah, whatever. And then I actually did.
Did you have is that your first dog of your own? Or did you have
I grew up with a dog that lived for like 17 years. He like actually just recently passed. But this is like the first dog that was like mine.
Yeah. Yeah. So you took him home. And how old was he when you took him home?
I don't know. He was very young. He had all his adult teeth, but Chihuahuas mature and grow up like very early. So they look like adults by the time they're like 6-7 months old. So he could have been like 6 months old. He could have been like a year old. He could have been 2 years old.
Right. Do you have any other animals?
Yes, so many. Yeah, so I have 2 cats that are also rescues that happened. One was like right before vet school, and the other was during vet school. I have sugar gliders. I have African pygmy dormice. I have snakes. I have fish.
Oh my gosh.
I have a jumping spider. And most of them are in like enclosures and cages and stuff. But yeah, and that's, for me, that's not that much. Like, there's been times where I've had, like, a ton of animals. Like, I've had a lot of different, like, reptiles and amphibians all at once. I've had, like, tarantulas and scorpions, like, many all at once.
Ooh.
Yeah, so I kind of have, like, a little bit of every kind of animal. I don't really do birds. I love birds, and I appreciate birds, but I don't see it for myself. You know what I mean? I don't see myself having a bird, but... Yeah.
Right. Because it's too much work,
it is.
Or you don't have the right space
for
it.
Yeah, just everything, all of the above.
Yeah. I feel like they need to fly, and I feel like, it's tough to have a bird.
Yeah, that would be ideal. And yeah, that would definitely be ideal. And I wish more people with like yards, like even if it's just like a small backyard, would set up like a flight cage or something.
Does that just mean like an enclosure so they can fly around in the yard, like a netted top or something like that? Uh-huh.
Exactly. Yeah, exactly. Like you see at like zoos and everything where it's just like a big like
Yeah.
netted structure so they can
Yeah.
I would love to see people doing more of that.
Well, I definitely have a full house there.
Just gonna say like it's kind of always changing. Like I'm always open to taking animals and everything. Um there was a time I was like this close to having an armadillo.
Oh my God.
It didn't work out, but that might still happen one of these days.
Where do you find the animals? Do you rescue them all, or how do you just come about them, or how does that work?
Yeah. So it's kind of just stumbling upon them. So
Hmm.
I before I was a vet, I worked in an exotic animal hospital, and it was only exotic pets. So
Mm.
I met like a ton of people that work with exotic animals and like zoological species through that job. Um, and then even just in college, so I studied zoology in college.
Okay.
Um,
Okay.
so that was like my undergrad degree was zoology. So that's when I chose, and I met a ton of people in there that wanted to be zookeepers, and I even kind of wanted to
Interesting.
do that for a little bit. So I know like a ton of zookeepers, a ton of people that work in like rescues, all that stuff.
Uh-huh.
So I'm always like hearing from people like, "Hey, my friend at this zoo has a bunch of these. Like, you want one?" Like, and stuff
Oh my
like that.
gosh.
So
So you've always been interested in animals. Did you know that you wanted to work with animals your whole life, or is that a kind of a
yes,
new development as an adult?
definitely my whole life. I definitely knew I loved animals and wanted to work with animals and like be
Hmm.
around animals, but I did not always know I wanted to be a vet.
Okay.
Really deciding to be a veterinarian was later in life. That was like in my adult life.
Okay.
It was always on my mind, of course, because when you're a
Right.
kid and you like animals, everyone's like, "Oh, you're going to be a vet when you grow up. You have to be a vet." You know, that's what
Right.
you
Right.
hear. Um, but yeah, I was not really too interested in it for a while because I was like, no, that's a lot of school. I hate school. I don't want to go to med school. Like, why would I do that? But yeah, when I got that job at that exotic animal hospital, that was like the beginning of college, and I loved it so much. And I was like, this is what I have to do. Like, this is clearly the path for me right now. So
Working with animals, being a veterinarian.
yeah, yeah.
So what led you
Hmm.
to Lap of Love, which is the company that you work with right now, which is um, Lap of Love specializes in end of life care, which is what we're going to talk about today.
Yes.
Hospice care and euthanasia, which is a really tough subject. Um, Obviously, it's incredibly important, which is why I wanted to have you on, because I think um, it is the tough part of being a pet parent is at some point you are
Hmm.
most likely going to have to deal with end of life hospice care and euthanasia if you're not lucky enough to have your pet pass peacefully on their own, which is rare, I think.
Yes.
But Lap of Love is an amazing company, and I know it's nationwide. And from what you told me earlier, you started out working with them just like in the office, right? And then you found your passion that way. Do you want to expand on that?
Yeah, I definitely did not know I wanted to focus on hospice. I wasn't even super aware of veterinary hospice during vet school. Like, I knew there were veterinarians that did in-home euthanasia and everything, but I was not aware of like the full scope of veterinary hospice by any means. Um,
Right.
so I started off after vet school. I started in Miami, Florida. Again, working with exotic animals because there's so many exotic animals in Miami. Like, that is the place. If you want to work with exotic animals, you need to go to
Right.
South Florida or Texas. Texas
Right.
and South Florida, those are the exotic animal places. um,
Do you have to study exotic animals in vet school? Or I feel like a lot of the vets that I've talked to studied like exotic animals as
yeah,
family
so
pets.
it's this is going to be kind of controversial, but I'll just go
Mm.
ahead and say it. But
We like that. Okay, go.
yeah. So basically, in vet school, it's man, I'm so sorry. I really don't know like a nice way to put this, but they try to appease the the students that are into exotics and stuff like that by having like little like mini
Got it.
lectures. They'll be like, "Oh, this is our exotic
Right,
animal
right, right.
course," and it's like one
Yeah.
short lecture in the morning, like once a week, that nobody goes to and nobody
Right.
pays attention to.
Right.
You know what I mean? So yes, it's part of the curriculum, but it's not
Yeah.
anywhere near like the level of dogs and cats. So I got to Miami, and basically Miami's super expensive, of
Yeah.
course. I needed more than one job. Like, I
Hmm.
couldn't, you do not get paid a lot right out of vet school. Veterinarians
Sure.
just in general don't make that much money. So as like a new grad in a new job, like learning, working under vets, I was not making that much money at all.
Yeah.
And that's a whole other conversation. Like
Yeah.
compensation in veterinary medicine is like a whole other story.
Compared to like the school loans and all of the things. Yeah. It's tough.
Exactly. And then exactly. And compared to like human doctors, like we make
Right.
like pennies compared to human doctors, and we do all the same things and sometimes more.
Right.
And that's not, that's not a shot at human doctors at all. That's just a
No.
fact.
Yeah. No, it's we touched on that in when I had not one more vet on. We talked about some of the stressors having
Yes,
to do with veterinarians. Yeah.
Yeah, so I definitely needed more than one job. So I was I found Lap of Love, and I was working for Lap of Love part-time, just answering the phones, and it was a work from home job.
Mm-hmm.
And I was just like log into the Lap of Love system, and it was everything from like scheduling appointments for people with like the doctors working out in the field. So
Mm-hmm.
like doing little mini quick consults for people, answering medical questions. Like, if somebody answered the phone and they didn't have much of a medical background and the client was asking a lot of questions about like the condition of the pet and everything, they could say, hey, I'm not really sure, but I can transfer you to Dr. Nick and he'd be happy to talk to you. And it was great. It was amazing.
Right.
I would literally do it at the end of the night. Like I would be working a full day at the clinic and I would go home and immediately start doing that for like 4 or 5 hours, which sounds insane. And looking back, I can't believe I did it.
Yeah.
And working for Lap of Love, it did not feel like I was going home and working more. Like I was very happy to do it and I was really looking forward to it. And it was so fulfilling and it felt so good to be able to help people in that way.
Right.
So I became very passionate about veterinary hospice, and it started to be something I really felt like was my calling. You know what I mean? I feel like a lot of people that get into hospice have that weird kind of indescribable feeling where it just feels like something they need to be doing. It just feels like what you should be doing, what you're supposed to be doing.
Right.
And there's really not too much else I can say because it's just a feeling that you get.
Right.
And you just have to listen to those gut feelings.
Absolutely.
You got to listen to stuff like that. So basically, again, to make a very long story a little shorter, I was working at the clinic and I saw someone do something very, very bad.
Oh.
Yeah, related to euthanasia and everything. It was really dark, really bad. Like I couldn't believe it was happening. I didn't.
I'm so sorry.
Yeah, it's okay. It was very hard to see, and to this day, I can't believe I even saw it. But at the same time, that put me on the track to hospice because when I saw that happen, I was just so like shocked and appalled and just like aghast and in disbelief. And I was like, this will never happen again when I'm around.
Is it something that commonly happens, or this was just some certain individual that did? Okay, someone just did something completely awful.
Yeah, like so ridiculous. Okay. I've never seen anything like it before or after. I've never seen anything like it. It's the worst thing within veterinary medicine I've ever seen.
I'm not going to ask what it was, but I'm so sorry that you had to deal with that. Yeah.
Yeah, no, thank you. I appreciate that. And again, it's like I'm grateful for the experience in the sense of the path that it put me on.
Yeah.
Yeah, and I hate that animal like had to suffer for that to happen, but now like it lit that fire in me to make sure no animal that I'm taking care of ever suffers again. Not that was my patient, but
right. But you know that you are giving the best end of life care that you can possibly give, and that's
exactly
a good feeling. Yeah.
Yeah, and then like literally the next week I went to that clinic and I was like, I'm so done. Yeah, and I quit. And then I went to Lap of Love and I was like, hey guys, like hospice is clearly my passion. This is what I want to do. Like I want to like be a doctor for you guys full time, not just answering the phones part time. And they were like, yes, they were immediately like, yeah, we would love to have you. So that's kind of how it happened.
You're lucky that you were able to find something that speaks to you so so deeply, and that that you're doing the thing that you're supposed to be doing, right? I think a lot of people strive to find that.
Exactly. And it's definitely, yeah. And it's weird because I've been very, very lucky and I would almost say privileged to experience that like throughout life,
right?
For some reason.
Yeah.
Like when I was in high school and like middle school, when I was younger, it was music. Like I was a band kid. I was in marching band and all that.
I love that. Cute.
Yeah.
What did you, so you play
that,
drums or?
Yeah. So I played trumpet and marching band all throughout high school and college, actually.
Oh
and
my
then
gosh.
I played French horn. Yeah, and I played French horn in band class. Most people just call it horn. Nobody really says French horn anymore.
Yeah.
But yeah, I played that in band class, and like that was my thing back then. Music was like my calling and my passion. And then when I got to college, it was like, exotic animals and working with all these crazy species and keeping exotic pets and all that. And then it became hospice was my calling. And now there's a lot of other things in life that I feel like are my next calling. And it's like I've always kind of had that where I just feel so drawn to certain things. And it's so clear that I should be involved in these certain things. And people ask, they're like, how do you know? Like, how are you so sure? How do you like find your passion? And I'm like, I don't know. Like, it's just
sounds like you've been pretty lucky.
Yeah. And I'm very grateful for that aspect, like, of my life. That's definitely one of the better aspects of the life that I've lived so far is that I've always had very like obvious callings throughout many stages of life. So
do you still play trumpet?
No, not
now?
really.
Or do you still do
not really? I
though?
really want to get back into it, like really bad, but it's been a while. Like I can still read music and I still like remember how to play it and everything, but I mean, it would take me a while to like be actually good at it again.
You said there are some other things that you're passionate about now. Do you want to share that or you don't have to?
Yeah, definitely. So I've always been into like tattoos and piercings. But in the past like year or two, I've started like really taking like the body art industry really seriously and really learning about it and like hanging out at shops and stuff and getting like high quality jewelry and like way more piercings and way more tattoos.
Yeah.
So it's like I'm hoping that can be my next like my next thing. I'm not going to leave veterinary medicine or anything. I would never do that. But I'm at a point now where my career as a vet has calmed down enough to where I'm stable enough in my career as a vet where I can explore other things now too without my practice suffering. You know what I mean?
Totally. And also that those things have a lot of creative expression in them. I think we all want to be make money doing having some sort of creative outlet as well. So, right?
Exactly. And everyone should have a creative outlet. That's so important.
Yeah. Well, let's jump into some of the harder stuff. Thank you for sharing all your stuff with us. Can we talk a little bit about Lap of Love, first of all, and what it is that they actually do? I know they're a really wonderful organization that I've been referred to, that I've referred some clients to, and that I have researched myself. Just kind of to prepare for those moments where my guy is a very healthy, almost 15, but I feel myself getting.
That's amazing.
And I know he's going to be 15 next month in February 21st. So technically, that's his adoption day, but I do find myself wanting to be prepared more, which is part of why I wanted to have you on to talk about that, because I think it's just so important for us to try to get as much information as we can, in order to prepare ourselves practically and mentally and spiritually and all of the things. I think the more we know, the more we can be prepared, even though that is not going to happen anytime soon for us. We have a good 4 more years, 5 more years, 10 more years.
I've seen it. I mean,
I know.
I've seen dogs go way past 15. So
I know. Oh yeah.
Possible.
He's not slowing down. He is technically slowing down physically and mentally, but other than that, he's trucking along. So
that's good.
I don't even want to. I feel like I'm going to jinx it by talking about it. So anyway, let's jump into talking a little bit about Lap of Love and what exactly that is and that they offer.
Yeah, definitely. Yeah, I think you made a great point saying that, it's important that we talk about it so we can be more prepared because, I think just talking about these things in in a very normalized setting like this really helps
Right.
destigmatize it, and it makes it less scary and less daunting and less
Right.
shocking,
Yeah. I
right?
mean, I
And
have a ton of
you know,
anxiety even talking about it right now. It's making me a little anxious and just,
yeah, and that's
I
normal. Like
know, I know,
that's very normal.
I know. So,
Yeah, that's totally okay, and that's I think that's where we come in with Lap of Love. Like we're the ones that can talk about it without being anxious,
yeah,
and
yeah,
we want to help you guys get there,
right,
and maybe not even there, but at least a little less anxious.
right.
You know, um, yeah. So basically, Lap of Love as a service. So we are a nationwide company.
Hmm.
So wherever you're listening, we're probably in your area. We're in almost every major city in the U.S. There's just a handful of states where we don't have any doctors. Um, we're not in Alaska or Hawaii yet, but hopefully that will come in the
Yeah.
future. Um, yeah, and we're a strictly mobile hospice service. We don't have an office. There's no clinic. There's no building. There's no office. There's nothing.
Yeah.
It's all mobile. We do everything in your home, and it's very, for lack of a better term, it's very, very low key.
Yeah.
We don't bring too much with us. We have doctor bags filled with all kinds of things, and that's it.
It would seem like from a veterinary perspective, might be something that's kind of like, you're helping people and pets, and it's almost like it's a much more peaceful
Yes,
gig.
definitely.
I mean, I know that sounds horrible,
No,
but
I
it's
know
just,
exactly what
you're
you mean,
kind
because
of,
that is how most
you
of us
know,
feel about it, for sure. Um,
yeah. And you have to have a ton of compassion to do that, I think, and to be a special kind of doctor, right?
yeah, I had no idea that I was compassionate in that way and that I was so patient and kind and all that.
Yeah.
It's something that became clear when I got into hospice. And that's kind of how it happens for a lot of us. We just feel that the draw to get into hospice, and then we realize
Right.
like, oh wow, I am someone that can do this. Like I'm someone that can guide families through this time, and I can be there for
Oh,
these people.
sure.
And it's you learn a lot about yourself, learning about not just how I react to that, but also seeing it from the perspective of from an outside perspective,
Hmm.
rather than being
Hmm.
the one that's directly experiencing it. Like
Right.
seeing it through a different lens, and seeing how, although this family is like heartbroken, they're also relieved. Like I can see relief through those emotions
Right.
because they see their
Right.
baby is finally okay and finally at
Yeah.
peace. Um, and
Yeah.
that was very
They're not in
interesting, and
pain
it really,
anymore.
exactly, and seeing that
Yeah.
really helped, um, kind of just normalize death and destigmatize death for me, and just it made me be able to see it as something natural and something that's okay and something that everything is supposed to do.
Yeah. And it's just so scary for for a lot of us, because it's the unknown
It
for
is.
us,
It
but
definitely is.
we mourn those that aren't here and we miss them. But
Definitely.
so let's circle back to what exactly Lap of Love does, like how they show up for you as a pet parent.
Yeah. So, in addition to what I was saying earlier, there's three types of appointments. One appointment is a tele-advice appointment,
Mm.
um, where you can just get on the phone with a doctor. You can get on Skype or whatever, FaceTime, whatever, with a doctor, and just talk about what's going on, kind of figure out whether or not it's the right time, when the right time might be. Now, we're not to the level of human telehealth where, human doctors can actually prescribe you
Right,
medications through
right, right,
telehealth
right.
and everything. We
Okay,
can't really do all that yet. Telehealth in veterinary medicine is very new,
okay,
but that is an option. And then we have
okay.
hospice appointments where, kind of similar, we discuss what's going on, see what's going on, assess the situation, and we figure out how to make your pet more comfortable until it is the right time. And that can be anything from like a new medication protocol to just adjusting the current
Right.
medication protocol to non-medical things such as like putting yoga mats down on the tile flooring so it's easier for him to walk, or putting water bowls in every room so he doesn't have
Yeah.
to travel too far to
Yeah.
get water. It's just
It's
simple things like that.
it's amazing how much those simple things. I have a golden retriever that I care for, who's Chance's best friends, and he's also almost
That's
15.
awesome.
And he
That's long. That's super
I
old for a golden
know.
retriever. That's amazing.
He's had like 9 lives. I mean, we're pretty sure he ate like
Yeah.
poison when he was 5, and he was hospitalized for
Oh,
like
he probably did.
3 weeks. He was
Yeah,
hospitalized.
that's a golden retriever.
Totally. We don't know what he got into, but they were like probably rat poison. And then he had a bout of possible cancer. Can't quite remember, but that was just a few years ago. Anyhow, and then he had like a back thing. And, once we put he gets acupuncture and he gets a lot of rehabilitative,
Yeah, that's
treatments and great stuff. But putting those rugs down on his area, like in the kitchen where he just kind of stays, they covered the kitchen with rugs. I mean, he's like a different dog.
See, isn't that crazy? Like,
Yes.
people don't realize how hard tile and hardwood flooring is for
Yeah.
dogs to walk on.
And get
Like,
up
for
from
some
when they're
reason, they
lying
just can't.
down. Yeah.
Exactly. So sometimes that little change, like, changes their life completely.
I think he was like putting his back out every time he tried to get up off the wood.
Yeah.
Floor. I think he was straining it, and putting those down, like he gets up. I mean, he still struggles to get up, but he's got grip, and once he's up, he's raring to go. Anyway,
Yeah, that's awesome.
It's really great. Yeah.
Yeah, no, that's great. And that's exactly what a hospice appointment is. It's like just figuring out what we can do to get them to that point. So we don't have to euthanize today. We can euthanize like a couple months later.
When are we supposed to reach out to you? Like, is it something that we discuss with our regular veterinarian, or how do we know when the right time is?
Yeah, that's a great question. Yeah, so then the other appointment we have is a euthanasia appointment, which is self-explanatory. That's when we come in and perform the euthanasia in the home. So when it's time, when you call, so first of all, you can call us whenever you want. Like, you can call
questions.
us.
Yeah,
you're always welcome to call, and people call all the time and just ask a bunch of questions. You do not have to be scheduling an appointment when you call. That's totally,
got it.
That's totally okay.
Yeah.
Yeah, so usually I would say that the typical kind of like pipeline of how people get an appointment with us is their dog's getting older, they bring it to their general practice vet, which is just, the vet you go to all the time for the vaccines and whatever. They bring their dog in, they say, hey, he's getting old. What do we do? And then the vet, without even realizing it, the general practice vet usually does a little hospice visit. Which is funny because a lot of vets are doing hospice and not even realize it. That's something we talk about a lot. So yeah, usually that happens. And then usually during that conversation or shortly after that appointment, they say, hey, you're going to want to start thinking about the transition. We can do it here, but there's also other options, and then that's when they'll mention Lap of Love or another company that does it. Or sometimes they do it. There are general practice vets that will, schedule specific appointments to go to your home. Not really as much anymore. That's getting kind of like old school. Not a lot of vets that do general practice do that anymore, but there are some.
Because why do you think that's getting old school? Just technicalities, or just because they're too busy doing other things? Yeah.
Yeah, both of those. So then that's when people find Lap of Love and call and schedule the appointment or just ask questions. But yeah, some people just honestly, sometimes it's just very, very clear. Like the animal is very obviously needs to transition, and people just find us on Google and just call and schedule right then and there. So there's a lot of different ways it could happen.
What if someone calls and they think their dog needs to be euthanized, and you get there and you're like, no, they're not. These aren't the signs of the dog needing to be euthanized.
Okay,
Does that ever happen or no?
Yes, it does. That's a really good question because I can totally build off that to kind of go over some signs because that's super important. So that definitely happens. And yeah, we just tell people like, hey, look, he's actually doing okay. We don't have to do this right now. Oftentimes we can, depending on the diagnosis that the dog has, if the dog has had a diagnosis, or a cat or whatever animal. Oftentimes it is technically humane to proceed. There's quite a few diagnoses where pretty much as soon as they have the diagnosis, it's okay to proceed at any point.
What would some of those be?
Yeah, definitely. So just off the top, like lymphoma, hemangiosarcoma, GI lymphoma, any kind of lymphoma. Let's see, any kind of like internal bleeding, any kind of like fluid buildup in the lungs or in the abdomen, anything like that, like you are okay to go ahead. It doesn't have to be right then and there, but it's probably going to be soon. So yeah, it just depends. And yeah, sometimes they just got diagnosed with, let's say lymphoma. They just got the lymphoma diagnosis, but like they're doing fine. And we just tell them, hey, we can use these meds for a while and he'll probably be all right for a little while. And we don't have to do it today. And usually people are cool with that. They're like, oh, okay, yeah, we'll do that.
Right.
But then, sometimes people are just on the page of, no, I don't want to see him go through this. I can't deal with that. I can't do this. Right. And that's fine.
Right.
That is totally okay.
What are some of the signs that it is time?
Yes. So signs that it's time. The most helpful thing I can say is that what's actually better to look at is knowing things that are not signs.
Okay.
So there's two things that people like cling to. And there are two things that are not good signs of how your pet is doing. So one is eating.
Yeah.
And then the other is tail wagging or like purring for a cat. And all the time, we hear it all the time. People will say, oh, but she's still eating. And what's very important to realize is dogs, especially, a lot of animals, especially dogs, will eat no matter what.
They're going to keep on going till that very last moment.
That's the thing. And we have to remind people a lot, like, that's not a good measure of where your pet is at, like, disease in the progression of their disease.
Right.
I've seen dogs in scary bad condition, like barely eating with us, that still like are somehow gobbling up food if you put it in front of their mouth. That on the other hand, if they stop eating, that's serious. If it's your lab golden retriever that eats everything and suddenly is not eating, that's definitely a sign that something's going on. But continuing to eat is not a good measure of where they're at. So try to not even like think about that. With tail wagging and purring and things like that, people will say, oh, I mean, he still wags his tail when I come home. So he's fine, right? And I'm like, yeah, I mean, he's happy to see you, but your dog, and sometimes our cats too, like they're going to be happy to see you no matter what.
Yeah.
It's and again, especially your labs, your golden retrievers, your
they're on
big,
automatic,
goofy, happy dogs.
Yeah.
No matter how they feel when they see you, they're going to feel amazing. They're going to be happy to see you. They love you.
You have to take the whole dog into consideration.
Exactly.
Right?
And on that same note, dogs wag their tails and cats purr for so many different reasons. It does not necessarily mean they're happy. Like, I hope.
Right.
I don't know if you've seen a dog fight. I hope you never have to if you haven't. But
I've seen many.
Yeah, oh yeah, I'm sure you have. Yeah, in your line of work, those dogs' tails are wagging like crazy that whole time.
No, they wag their tails for arousal. They wag their tails pain sometimes. Yeah. My dog has sciatica. My dog gets sciatica, and his tail has just started. It does like a really rapid wag, and then it lands to the left. And I, showed my veterinarian a video, and she's like, "Yeah, that's probably where his sciatica is having an issue." Yeah. And so for whatever reason, his tail is wagging in response to that, because it's like it's a stiff, not normal attack. Yeah. Happiness is a wavy, relaxed, flowy tail, right, for the most part. Any other tail is telling you either they're very excited, they're upset, or
anxious.
But anxious, So anyway, so those are not good good signs of where your dog is at, as far as if they're ready to transition or not.
Exactly.
So what are some pretty obvious signs?
Yeah, so
then?
pretty obvious signs. All I need to hear as the vet, I don't care what your dog's diagnosis is. I mean, I do care, but I'm not worried about the name of your dog's disease. If you're telling me that he's not happy or she's not herself, anything to that effect, that's all I need to hear. And, I think we get so caught up in the disease process and, the vet said, she has 6 months to live. The vet said, at this point, we'll have to do this and we'll up his meds at this point and da. And it's like, yeah, that's important to be aware of. That's, of course, very like vital information to have. But no matter what dose of medication they're on, no matter how long they've had the disease, if your animal is not happy, then it's time, right? Like that's what I need to know. I need to know whether or not your animal is enjoying their life and enjoying the things they usually enjoy doing. Are they able to do the things they enjoy? Things like that. And, people call in and they're like, I don't know how he's doing. He's just not himself. He's not happy. He doesn't enjoy anything anymore. He's just always uncomfortable and miserable. And that's all we need to know. And your dog better than anyone. Your dog better than any vet, better than any animal trainer, better than any veterinary nurse. It's your dog. Your dog's person. And when you see your dog is miserable, like that, you can trust that. You can trust that feeling. That. Like you're not lying to yourself. You know what I mean? You can trust that intuition.
How do you approach people who may not, it's really, really tough. So I don't envy anyone who has to, go through this, but who may not be, willing to see that their dog they're just not ready to let go yet. Mm-hmm. So they may not be willing to see that their dog is, in fact, just really, for the greater good of the dog, he needs to be euthanized. He's in pain or whatever. How do you approach that with your client? Obviously, you can't force them to do it.
Yeah, definitely not. And, that's the thing. We're not here to force anyone to do anything. Yeah. We're not here to judge anyone. Yeah. This is all very subjective. It's going to look totally different for every family. And we know that.
Right.
Yeah. And to answer your question, it kind of looks a little different for everyone. Some people, you just have to hit them with the logic. You just dump that logic on them and then they're like, oh, okay. And it clicks because, the doctor is there seeing the animal and the doctor is telling you what's really happening. And so that's what some people need. Some people need the doctor to tell them what's happening. And then they're like, oh, okay. Right. And they go from there. Now, on the other hand, sometimes what's really helpful for people to understand is that we see euthanasia as ending suffering and putting dogs out of their misery, out of their suffering. But what we're also doing with euthanasia is we're preventing further suffering from occurring.
Right.
So what we need to explain to people a lot of the times, especially if it's someone that's, it's their first pet, they've never been through euthanasia, we need to let them know right now we have this ideal window of time where we can make this very easy and very peaceful and very quick and very calm for your pet. But very soon we might be past that point and your pet might suffer a lot more than it needs to. And you might find yourself in a critical emergency situation. And rather than it being calm and easy at home, you might have to rush your pet to the emergency room. And of course, sometimes that happens beyond anyone's control. Sometimes that just happens. And that's okay. That doesn't mean you're a failure or anything like that. That just happens sometimes.
Right.
Yeah. So, it's just a matter of really helping people understand we have the opportunity to make this easy. We can make this easy for them. Mm-hmm. And if we wait too long, it can very quickly become not easy. So, it's just a matter of really, really understanding that, again, we can cut the suffering off. We don't need to make the suffering continue. We can end the suffering, but we can also stop it in its tracks. So,
as tough as it is.
It is, it's never easy. It's not easy to see. It's not easy to make that call. No matter how clear it is sometimes, It's always difficult.
How do you deal with the emotional toll of both for the client? I'm sure it's tough. A lot of what you do is emotionally supporting the client who's going through this. And then on the flip side, how do you deal with your own, you can answer if you want to, your own emotional support in having a job like that where you're seeing so much loss and seeing people, in a lot of pain, and you're doing right by them, by helping them through this, but I'm sure it takes a toll, and I don't know, in some form or another. I could be wrong, but
no, that's a very good question.
Two-part question.
Yeah, no, that's a great question, and I really appreciate that because, I'm sure you've had a lot of vets on the show. I'm sure you know by now, mental health and veterinary medicine is huge.
It's tough stuff.
Mental health it's hard for us. And, I've been very fortunate to work for Lap of Love and do hospice, and my mental health has been like better than I ever thought it could be since doing hospice, which I'm forever grateful for. And I owe so much of that to Lap of Love as a company. And for me, it's with hospice, as intense as the work can be, we do have a really good work-life balance in the sense of like days off and like hours worked and everything.
Right.
We're not stuck in the clinic for 14 hours, 6 days a week.
Right.
You know what I mean? Like running like crazy the whole time. Our jobs are calm. Our jobs are slow paced.
What you're there to do. Yeah,
exactly. And, I know I'm done at this time. I'm going to be done by this time, and no one's going to call me back into the hospital in the middle of the night. So again, as present as you have to be and as intense as it is during your workday, you're going to have a lot of time where you're not doing that. So you have that reserve, like you're able to really put your whole self into it. And then on that note, I mean, I do a lot of things other than being a vet. I'm into a lot of different things. Like we were talking about earlier, I'm into tattoos and piercings and stuff. I hang out at piercing shops all the time. And it's so funny because it's like, I'm like the doctor, and it's like a whole thing. And it's hilarious because I'm like, I was actually just talking about this with some of the other vets I work with. A lot of my friends outside of veterinary medicine are so modified, have like a ton of like extreme body modifications, like face tattoos, like, so when I'm with them, I feel like I have like no tattoos. You're
like the nerd. Yeah.
I'm like the normal one.
That's cute.
Stuff like that, having a life outside of the profession like that, to me, I really feel like that makes you a better vet.
Sure.
I think it makes me a better vet because it makes me able to fully be in it when I'm at work. When I'm at appointments, when I am Dr. Nick, I am fully Dr. Nick. Because again, I know there's going to be plenty of time where I'm not.
Well, good. I'm glad that you have that. Yeah.
It's really hard that a lot of veterinarians are not afforded that. My dream for veterinary medicine is that everybody somehow finds a way to make every avenue of veterinary medicine like that, where you have enough time off and, where you can reset and you can be who you are outside of work and then be who you are inside of work too, because a lot of veterinarians are like trapped in this cycle where they're a vet all the time. They're never really off work. Like they're going home and they're consulting all night and doing records all night and getting called back into the hospital and then going back to the hospital again at 7 a.m. And you know what I mean? And it's so heartbreaking to see, because I'm like, most veterinarians are so extremely like compassionate and passionate about the job, and it's just that's just such a quick way to like beat that out of somebody.
Right, burnout.
You know what I mean by overworking someone, and I just really hope we figure it out. I really want to like really start being more loud about that, and because we need to figure it out.
That's part of the vision for this podcast, is to create awareness around all things related to dogs specifically. Someday cats maybe, but dogs. And part of that is, part part of that is, the people that care for them, as I've mentioned. And the more we talk about those kind of things, the more people.
Yeah, that's how it starts, right? Is just having that open dialogue.
Yeah. Yeah. So thank you for that. I wanted to circle back and talk about how you do navigate the emotions of the clients,
For me, this is another thing is very different. Like literally every family is totally different. Some people have been through before and it's very clear that it's time and they're just so at peace with it and they've already had their reaction. And, by the time I get there, like they're so ready and they're just like, go ahead and, I do what I need to do. And they're just like, thank you so much. And that's it. Because they already went through it. They went through it before I even got there. And then by the time I got there, they were good. Which that happens a lot.
Right.
And, some people, I would say actually most people, they, as far as supporting people in their emotions and guiding people through their emotions during these times, a lot of people just need you to reassure them that they are doing the best thing.
Right.
That goes such a long way. And just when people see how calm and okay you are as the vet, they take that on. Because I mean, the procedure is very serious. This is a very serious procedure that not just anyone is doing. Something you really have to know what you're doing to make it go okay. And, I think a lot of people know that if anything goes wrong, it's going to be very clear. So they look to you for that. Right. For that reassurance and that confidence that everything's going okay.
That they've made the right choice and that you think that's the right choice and that you're on board with it and that they trust you.
Exactly.
Right?
Exactly. And then on top of all that.
That helps with the emotions.
Yeah. Exactly. And then on top of all that, I'm doing the procedure correctly. I'm keeping their pet comfortable. I'm, their pet's not suffering, all that. Yeah. So, it's just a matter of being that figure for them to just, be that reassuring figure.
Can we talk about, can we get a little technical here and talk about what exactly the procedure is?
Absolutely.
Just so people can kind of know, what we don't, I know it's not as scary, I think, as one might think, but what is the medicine and all of that jazz?
Yeah. So, we can definitely go over that because it actually is very straightforward. It's nothing too complicated. Okay. Again, I was saying earlier, it's very serious, of course, but it's nothing complicated. All we do is, just really strong sedatives and pain medications first. And that shot is just like any other shot. It's just like vaccines, medicine, stuff like that. Every now and again, there's an animal that'll react to that a little bit because they don't like the pinch from the needle, but it's nothing that hurts them.
Yeah.
It's just again, any other shot. As far as the medications for that, I can't really speak on that because everyone does it differently. So what I do, I use, the only human drug I use is ketamine. So I use ketamine and then butorphanol, which is an opioid. So like morphine. And then acepromazine and xylazine, which are just veterinary sedatives. So yeah, they get a mix of all that stuff. Yeah, so they feel amazing. They're like cloud nine.
They're just relaxed and they're, cloud nine. Yeah. So
yeah, and they can hear you. They're aware. They can hear you. They can see you if their eyes are open. They're just still feeling amazing. No anxiety. Not feeling anything physically. Physical feeling is gone. They're just like floating there with you in their home.
Right.
So they feel great.
Right. It's like an anesthesia, right? So.
Yeah, basically. Yeah, exactly, actually.
Yeah. I was just thinking the only time I've ever been on anesthesia, that's what it seemed like. Yeah.
Yeah, that's what they feel like. And usually just after just that, people already start feeling better because they see like that stark difference from when their pet was suffering to being in that state. And they're like, okay, this is what she needed. She needed this. Once that fully takes effect, then we can do all like the cute stuff. We can make like keepsakes and everything, like a clay paw print and a fur clipping and all that. I love.
So you do all that stuff? You do that?
Yeah,
stuff?
yeah.
Oh, I love that.
Definitely. Yeah,
Oh.
it's fun. I like doing all that. um, yeah, so then we can do all that, and I've done a couple nose prints,
You have?
and that's super fun. I'm not that good at them, but every now and then I get like a really good one, and I'm like, oh yes.
I would do that. Yeah, I do that for chance. For
Yeah,
sure.
yeah. You can definitely ask for that. That's definitely
Okay.
something you can ask for.
Okay.
Yeah. So just a second. So with the sedation, the only truly scary thing that can happen under the sedation is it is possible for your pet to have a seizure under the sedation. Um, that's just a side effect that happens
Right.
sometimes. It is very rare,
Right.
exceedingly
Right.
rare. And usually if it happens, it means they already had something, some kind of condition that was
Yeah.
predisposing them to seizures, whether they've had a seizure yet or not. But that being said, it's very easily controlled with an anti-seizure medication. So the majority of hospice vets will have that on hand and can just get that under control
Right.
real quick.
Right.
So even if that happens, that's not something, and it's not something they're aware of. They don't know that's happening.
Okay. Got it. Oh, got it. That makes it.
You know,
That's better. Yeah.
exactly. It's just visually unappealing
Yeah.
to
It's
us.
scary. It's very scary to watch. Yeah.
Exactly. Exactly. But it's something we can get under control very easily and very quickly.
Okay.
Yeah. So then once they're ready for the final medication is pentobarbital.
Okay.
And a lot of people think it stops the heart. It does not stop the heart directly.
Okay. That's
All
good.
it does is it shuts down the brain.
Mm-hmm.
So then when the brain turns off, everything else stops. And that's kind of what happens when we sleep.
Yeah. Yep.
Yeah. So to them, they literally just feel like they're drifting off to sleep, and it's super easy on them.
Okay.
And that's it. That's all it is. It's so easy for them. And as the body's relaxing, as that medication's taking effect, sometimes literally nothing happens.
Yeah.
Sometimes they breathe a little quickly. They let out some like really big deep exhales,
Right.
which is totally normal. That's just the diaphragm relaxing.
Mm-hmm.
Very normal. Sometimes there's like little minor movements. They might stretch their legs a little bit. They might stretch their neck a tiny bit. They might twitch a tiny bit. Again, all super normal. That's just the muscles relaxing. Yeah, and that's really all there is. It's very easy. It's way less scary than a lot of people are anticipating.
Very doesn't sound very traumatic. I mean, for the dog, at least, it doesn't sound traumatic. It sounds very peaceful, right?
Definitely. And, I would say, I mean, the amount of people that when it's their first time seeing it and they're like, oh, wow, that was like nothing. And yeah, that's exactly, it's nothing too crazy. And that creates a lot of calmness for the people as well, and that really helps with emotions as well when they do see just how okay it was.
Right.
Yeah, so that's kind of what the actual procedure looks like.
I have one more question for you, and that is, who should be there during this? Should other family pets be there? Because I've heard mixed things. Should your other dog be there, or your cat if you have one, or
Yes, definitely. All the other pets should be there.
Okay.
They understand. They know what death is. Death is not stigmatized for them. It's not scary to them.
Right.
It's not sad to them. To them, it's what happens.
They know.
It's normal.
Yeah.
Yeah. And they know that the patient is sick. They know. I mean, think about it. If we were to see a person in end-stage kidney failure or congestive heart failure or something, we would know. We would know that they're very sick. And it's the same with animals. They know, they can tell, and they expect this to happen.
Right.
They understand. Oh, this one's super sick. This one's going to transition.
Right.
That's nature. Right. That's just logic to them. So sometimes they sniff. Sometimes they cuddle a little bit. But sometimes they're just in the room and they don't really even do anything because they're just like, oh yeah, I know.
Right.
And I think a lot of people will say, oh, well, my other dog was like super depressed and super anxious afterward. And most of the time that's because you left with your other dog and didn't come back with it. And then the dog at home is just like, where's the other dog?
My friend. Yeah.
Like what happened? And it's confusing. They don't understand. But when they see the transition, they know, they understand that they're not going to see that animal anymore.
Right.
Yeah, and honestly, the best thing for your other pets is to just do all the same things with them. Feed them at the same times, walk them at the same time, sit on the couch with them at the same time. You always do. You know,
keep their routine
just like
the same.
Act. Yeah, just act regular to them. And you know, of course, you're going to be sad and everything, and that's fine. You know, you can be sad in front of them. That's okay.
Yeah.
But when we put our emotions on them and we're like overly loving toward them and like snuggling them super hard and like screaming in their face and everything, you know, that's when
that's anxiety.
That's when they're like, that's when they're like, oh my God, what's wrong? Like, what is going on? Like, why is mom doing this? Oh my God. And so, you know, that's not advisable.
Right.
Yeah, and other animals do great. It's not scary to them.
Yeah.
You know, this is not something that's scary.
But if you have just like an overly excited puppy or you know, a dog that's just high energy, I would assume you just maybe manage it by maybe putting them somewhere where they can watch or putting them in another room and then letting them come and make sure and sniff, make sure they know what's going on. Right.
Yes, exactly that. Yeah.
When it's all said and done.
Exactly.
Okay.
Yeah, and that is the thing. They only need to be there for the end. They don't have to be there for the whole procedure. Just as long as they can see your animal afterward. That's what's important.
Got it.
Yeah.
Right. Well, thank you so much, Dr. Nick. Do you have anything else that you want to add? I think we covered so much.
Yeah, no, I think we did cover just about everything. I put out videos on social media every now and then. Not always related to hospice, but every now and then I have like little pointers about hospice. So sometimes that's helpful to people. One thing that I guess I can leave everybody with, about death that we all really need to consider that it is something that is natural and it's supposed to happen and it's okay. And we as humans, we have the ability to make it a little easier than it might have been. And, you know, as dark as it all can be, I think that's a very beautiful part of what we're able to do.
Thank you so much for listening to this episode of the Baru Podcast. If you want to contact Lap of Love Veterinary Hospice, you can reach them at lapoflove.com. And if you want to follow Dr. Nick on Instagram, you can follow him at Real Dr. Nick. And I put both of those things in the show notes, so no need to worry. And as always, if you enjoy listening to the Baru Podcast, please don't forget to rate us and follow us wherever you get your podcasts. You can also follow us on Instagram at Baru Pet. And if you have a question for me or a story of canine companionship that you want to share on the Baru, you can email me at charlotte@thebaru.com. All right, you guys, let's chat next week.